Hi, my name is Brooke Knowles. Today's April 27th, 2020, and this is the list of topics I will be discussing today. Main topic is the integumentary system, which includes our skin, or cutaneous membrane is another name for it. The integumentary system also includes the accessory structures that are in the skin, which are our hair, our nails, and exocrine glands that secrete oil and sweat. The outermost layer of the skin is called the epidermis. The epidermis synthesizes vitamin D3 from the sun. It also protects the layers beneath it from trauma and from exposure to chemicals. On the palms of our hands and the soles of our feet, the epidermis has 5 layers, and this is what's called our thick skin. Those 5 layers, starting from deep to superficial, are stratum basale, stratum spinosum, stratum granulosum, stratum lucidum, and stratum corneum. The rest of our body, which is the majority of our skin, the epidermis only has 4 layers, where the stratum lucidum is absent. So it's thin skin. It only has the 4 layers. Underneath the epidermis, you have the dermis, which has just 2 layers. On top is the papillary layer, which is loose connective tissue. And then under the papillary layer, you have the reticular layer, which is more dense connective tissue. In the reticular layer, you have a really extensive network of blood vessels. So a lot of our thermal regulation takes place in the reticular area, or reticular layer. Let's see. Hi, my name's Brooke Knowles. Today's April 27th, 2020. These are my notes for today's discussion. Topic for today is the integumentary system. The components of the integumentary system are our skin, which is also called the cutaneous membrane, and then also the accessory structures to the skin, which are our hair, nails, and exocrine glands. The outermost layer of our skin is called the epidermis. The epidermis synthesizes the vitamin D3 from the sun, and it also protects the other layers from trauma and exposure to chemicals. On the palms of our hands and the soles of our feet, the epidermis has 5 layers. It's called thick skin. The 5 layers from deep to superficial are the stratum basale, stratum spinosum, stratum granulosum, stratum lucidum, and then stratum corneum. Now, the rest of our body is called thin skin, and the stratum lucidum is absent, so you just have the other 4 layers. Underneath the epidermis, you have the dermis, which just has 2 layers. On top is the papillary layer. It's made up of loose connective tissue. And then underneath that is the reticular layer that's made up of more dense fibrous connective tissue. In it, the reticular layer surrounds hair follicles, the sweat glands, oil glands, and it's also made up of a really extensive network of blood vessels. So a lot of our thermal regulation takes place in the dermis. Underneath the dermis, you have the hypodermis, which is more loose connective tissue that separates the skin from the deep fascia that surrounds our organs like muscles and bones. The integumentary system is important for myself in my future career as an occupational therapist, and even it's important right now as I'm a certified occupational therapy assistant. A large number of OTs or OTAs work with individuals who have impairments in their sensory integration. And our sensory receptors are found in our skin. So this topic applies hugely in occupational therapy. We have to find ways that we can help these individuals. For instance, individuals with autism spectrum disorder, where their sensory integration is impaired or Hi, my name is Brooke Knowles. Today's April 27th, 2020, and I have the notes here on today's topic, which is the integumentary system. The components of the integumentary system are our skin, which is also called the cutaneous membrane, and also, in addition to the skin, the integumentary system includes the accessory structures to our skin, which are our hair, our nails, and our exocrine glands. The outermost layer of our skin is called the epidermis. The epidermis synthesizes vitamin D3. It protects the lower layers from trauma, from exposure to chemicals, and the epidermis also contains some of our sensory receptors. On the palms of our hands and the soles of our feet, the epidermis contains 5 layers. This is called our thick skin. Those 5 layers, from deep to superficial, are the stratum basale, stratum spinosum, stratum granulosum, stratum lucidum, and stratum corneum. Everywhere else on our body, the epidermis only contains 4 layers because the stratum lucidum is absent. So this is what we call thin skin. So most of our body is covered with thin skin, and just the palms of our hands and soles of our feet has the 5 layers of thick skin. Underneath the epidermis, you have the dermis. The dermis has 2 layers. Papillary layer on top. It's made of loose connective tissue. And then the reticular layer underneath that, which is it's more dense connective tissue that surrounds the hair follicles, the sweat glands, and contains a lot of blood vessels. So the dermis is responsible for a lot of thermal regulation for our body. The dermis also contains more sensory receptors. And then underneath the dermis, you have the hypodermis, which is more loose connective tissue that separates the skin from the deep fascia that surrounds our more internal organs, our muscles, our bones. So, having said all that, the clinical application for myself of the integumentary system, as I work right now as a certified occupational therapy assistant. I'm pursuing my master's to become an occupational therapist. A large number of people in occupational therapy professionals work with individuals that I don't want to say lack the ability, but have impaired sensory integration system. So our integumentary system is what contains our sensory receptors, how we feel the stuff around us. It's how we interact with our environment. So in the case for people with such things as autism spectrum disorder, the sensory integration system is not functioning properly, and it can have huge negative impacts on the way that somebody takes in information from their environment. It can have adverse effects. And it just makes it really hard for people with an impaired sensory integration. It makes it hard for them to respond to those stimuli from the environment. Makes it hard for them to function in their normal everyday activities. And so that's what occupational therapy is helping people function the best way that they can in their everyday activities. So we take huge consideration with the sensory receptors in patients with such things as autism spectrum. So it's pretty big for us. Definitely applies to what I will be doing or may be doing in the future, but definitely applies to what a lot of occupational therapy professionals do every day. So, that's it.